welcome back to the Oral Health Podcast as we start 2026 off with a bang to talk about dry January, something we've spoken about before, but is something that is always going to be important, something we're always going to talk about. Lowering your alcohol consumption will lower your risk of mouth cancer, so that's point number one. Point number two, obviously, there's plenty oral health implications for some of the most popular drinks, and that's what we're going to talk about today. So, Karen, How are you doing? How was your Christmas, New Year? Are you doing dry January?
I do try to. I do try to. Yeah. I mean, we often have parties and stuff around Christmas, don't we? And New Year especially, where we might sort of indulge in our favourite tipple. I always have a bit of a weird thing about dry January. Do we get an exemption on New Year's Eve because it's actually New Year's Eve? And even though
Hmm.
we might be up past midnight, do we not count the 1st of January? I know I'm picking hairs, but I find it quite important that I get that correct in my head. Um, but yes, I know a lot of people do dry January for various health reasons, and there's no better health reason than your oral health, really.
Exactly.
When we look at alcohol, alcohol is, you know, we know it's not good for our body. It's not particularly good for our mouths, as you mentioned. Mouth cancer risks with alcohol are, one of the top causes of mouth cancer. But there are other reasons as well. It dries our mouth out because it dehydrates us, which, as we've talked about before, not having a lot of saliva in our mouths can cause bad breath. It can cause dental decay. It can cause gum disease. So we really need to keep our mouth as hydrated as possible. Um, Also, from a fact of it's a lot of sugar as well. We're
Yes.
talking about a lot of sugar, especially mixers and fruit ciders and cocktails and these kind of things, full of syrups and high fruit and yeah. So we've got a lot of sugar going on there, and that means that our teeth are, whilst we're having those drinks, our teeth are in a lovely sugary bath for could be several hours, and acidic as well. A glass of wine, we've got sugar and we've got acid, so double whammy there really. And one thing that I always say, I'm a dental bore. When if people come round and I'll say to them, they finish the glass of wine, and I'll go, right, if you're going to go to bed, you need to wait for an hour before you brush your teeth because you've just put something sugary and acidic on it. You've demineralized the enamel on your teeth. And if you brush too soon, you'll brush that loosened enamel away, which can lead to enamel erosion if it's done often.
Yeah.
So yeah, just be mindful just before you go to bed. You can speed up the process of remineralization by using the fluoride mouth rinse, by chewing gum, sugar-free chewing gum for 20 minutes, or even having a glass of water, which often helps as well if you've had alcohol because it will keep you hydrated. Um, Ideally, alcoholic drink, glass of water, alcoholic drink, glass of water, would be better. And a sugar-free mixer
Hmm.
will also reduce the amount. But if we're doing dry January, we're not having any of those anyway, are we? But we don't want to
Exactly.
exchange the alcohol for sweet, sticky fruit juices, smoothies, fizzy
Yeah.
drinks, that kind of thing. So, um, dry January might be nice if we just had water.
But how dull
Oh,
is that? But you
well,
can always go
yeah,
out for a coffee, and I know a coffee's not innocent either, in
no,
terms of staining and things like that. But so is a lot of red wine. A lot of red wine is
true,
very staining.
true. Yeah, well, and also, a good thing as well is to use a straw. You can get
It's
away with
true.
it with a cocktail, maybe a pint. You probably wouldn't get away with it quite so well, but using a straw means that the liquid is in less contact with the teeth, so it's sort of being directed into the throat. So you do get less of the staining issues, the the sugary and acid on the teeth. So that is another option if you're going to partake. But as I say, some drinks lend themselves to a straw, don't they? I can't see an IPA with a straw, can you?
Or a nice expensive glass of wine with a
No,
straw.
maybe not.
Half the drinking
Maybe not.
experience is like the swilling around the mouth, and the
Oh
enjoyment you get from
no.
that is bad for your mouth, it's bad for your
Yeah.
teeth, and
I
that's just
don't
the
I don't
reality.
like the swilling bit.
You don't do the
No, no.
thing that people
Oh,
do.
you sound like Hannibal Lecter.
Thank you. Very kind.
Yeah. So are you doing dry January?
I normally try my best. And for me, I mean, I'm not a big drinker anyway, but if I go out to the pub, I'll normally have, one or two. I like to just cut down. I find if I just cut down, then it's better than nothing, isn't it?
Does it depend if I've stressed you out in the office
Yeah, it
that day?
does. It does.
Okay. I
Definitely.
thought it'd be my fault.
But it is a stress relief, isn't it? Going out for a drink and it's social life, and you don't want to sacrifice any of that. So if you can just opt for ones that are less damaging to your mouth, then that's a win-win,
Absolutely.
isn't
And
it?
we do use it as a crutch, and I think that is probably, to our detriment in a lot of ways because you've got a lot of calories in alcohol. It is addictive, and
Mm-hmm.
we probably should. Now, I have a husband who doesn't drink at all, and he has more fun. And he's the first one on the dance floor. He's the last one on the dance floor too. So, he doesn't he doesn't need that drink. But sometimes it's nice to just have a sociable glass of wine, isn't it? Just in
Yeah,
moderation.
exactly. And I
The key.
mean, yeah, moderation is key. It's just a case of knowing what the risks are. And, we're talking about the risks to the teeth and the risks to the mouth. And as you mentioned, mouth cancer, alcohol is one of the biggest causes, especially when we look at alcohol and smoking combined. Drinking alcohol to excess is going to raise your risk of developing mouth cancer. There's
Yeah,
no way to get around it. It just will.
a lot of people smoke if they are smokers, smoke more when they drink. And
Hmm.
that does include vaping as well, because vaping dries your mouth out as well. So you're not sort of, although vaping doesn't have the tobacco, which is the cause of the of mouth cancer, it's not completely innocent in these things. So ideally, if you don't have if you don't have drink, then you're less likely to want to smoke or vape. So,
Absolutely. And it's just simple things. If you're having a cocktail or a mocktail or a sugary mixer, watch out for the sugar levels, watch out for the acid levels. Do things like shove a sugar-free chewing gum at the end of the night. Drinking water, have a fun drink and a water, a fun drink and a water. Just to try and keep your mouth more hydrated.
we're not the fun place, are
Hmm?
we? We're not the fun place.
We're not the
Do
fun police. It's just about being sensible, isn't it? Which is exactly what a fun police would probably
it's
say.
yeah.
Just be sensible and have fun, but just be aware of your consumption. Dry January is a great place to start with cutting down alcohol. If you can do it for a month, you could do it for longer than a month. And cutting it out is going to make you healthier in many ways. It's just our job to talk about the ways it makes your mouth healthier. So I hope you've learned something. I hope Dry January is going well for you if you're listening. And if you haven't started it yet, then don't worry about it. Just start a little bit later. It's still better than not doing it at all. Now, come back one next time when we're going to talk about Blue Monday and the ways that low mood and low motivation can impact your mouth health.